Violent attacks on staff in Adelaide's major hospitals have surged to as many as 19 a day. Senior medicos telling 9 News they fear a doctor or nurse could be killed.
Doctors and nurses attacked by the patients they're trying to help, something that's happened to Megan Brooks more than once.
Even though he was being restrained by multiple security officers and 4 police officers, because of his agitated state, he was able to reach around and grab my arm, and it actually took about 5 people to pull him off me.
So too for David Pope.
I've certainly been spat at a number of times. I've been hit over the back of the head quite violently by a patient.
The attacks are called a code black. They're happening more and becoming more vicious. Patients even pulling knives. On at least one occasion, police had to draw their guns.
Those sorts of incidences become very close to either a patient being killed or a member of the public being killed or even police officers being killed, not to mention the medical staff who are in the firing line.
The Royal Adelaide Hospital is the scene of the most violence, with 1,059 code blacks in just a 5-month period. A substantial rise at the Lyell McEwen too, with just over 1,000 serious incidents. At the Queen Elizabeth, 311 attacks, and at Modbury Hospital, 279. Doctors angry because drunks are the worst offenders.
Having to divert our care and attention away from people who are having heart attacks, strokes, have been involved in car accidents.
And it's a burden on taxpayers.
In 4 years, the government have spent $51 million on security alone.
Now, Will McDonald joins us live from the Royal Adelaide Hospital. Will, how have health authorities reacted to this spike in attacks on staff?
Yeah, good evening, Brendan. Well, SA Health is certainly concerned about the violence in our hospitals, and late today issued a statement to 9 News. Now, it says the government has acted to change the laws so that anyone who intentionally hurts a health worker faces up to 25 years in jail. Now, prosecutions through the court obviously take time, and doctors want much swifter action. They say they need more and better trained security staff, as well as more issues to deal with more resources rather, to deal with drug and alcohol issues, as well as mental health patients. It's back to you.
Thank you, Will.